The ASSURE trial looked at sunitinib or sorafenib, showed no difference in progression-free survival or overall survival. We had the ATLAS trial, which looked at axitinib, again, no difference in progression-free survival or overall survival. In the PROTECT trial with pazopanib, again, no difference in overall survival or progression-free survival. But we did have the STRAC trial, which was a trial that really looked at very high-risk patients, and that showed that with sunitinib 50 milligrams daily on the traditional 4-2 schedule for 1 year versus placebo, there was an improvement in progression-free survival, on average about improvement about 1 year, 5.5 versus 6.5 years. Although with the data so far, we don't see any improvement in overall survival. So given that it has been FDA approved, I think it's an option for patients who want to pursue that therapy. I mean, with understanding that there are side effects that go with that. I counsel patients on adjuvant therapy in the context of several ongoing trials. We have the perioperative trial looking at nivolumab, the PROSPER trial run by Lauren Harshman and Dana-Farber, which you do nivolumab pre-op followed by nivolumab for a year afterwards versus observation, which is a great option, as well as the trials looking at pembrolizumab, again, pembrolizumab versus placebo. There's a trial with atezolizumab versus placebo. And so all those trials, you know, the patient runs the risk of getting nothing. And so I think, you know, as I'm counseling patients about options, I have to, they're often very concerned, like, well, you're telling me there's a drug that's approved, but there's this trial open and you say get nothing. And so I think that understanding the benefits of what sunitinib offers is something that really involves a balanced discussion with a patient. And for some patients, it's certainly the right thing for them. But for a lot of patients, I think that you know, if there's non-improvement overall survival, the thought would be you may be able to treat patients at first sign of recurrence, and they could do just as well and potentially avoid those side effects.